Hello everyone. Today we'll be talking about ECG changes in right atrial enlargement. Right atrial enlargement is defined as presence of peaked P waves with amplitudes in lead 2 of more than 0.25 millivolts. So what do you mean by 0.25 millivolts is 1 millimeter. 1 millimeter is equivalent to 0.1 millivolts. So this means that if the peak P waves amplitude is more than 2.5 millimeters in lead 2, then it is called as right atrial enlargement. So as you can see here, this is a lead 2, which is a ideal lead to study about the P waves, and also lead V1, because in lead V1 what happens is there is biphasic pattern. So P wave is biphasic. That is, the initial part is because of the right atrial depolarization, and the second half is because of the left atrial depolarization. So what happens is, because the right atrium is very much enlarged, so it will take more time, and it will take more contraction will be there. There will be more depolarization. So that's why the height of the P wave is increased. But the second half is formed because of the left atrium. Since there is no left atrial enlargement, the duration will not change. So this part of the second half is remaining same. So duration remains same, but the height increases to more than 2.5 millimeters or more than 0.25 millivolts. So that is suggestive of what is called as right atrial enlargement. So more than 2.5 millimeters in the inferior leads. So in ECG wise, if you calculate, is each small square is 1 millimeter. So if you take a small each, this is a whole large square, and each small square is 1 millimeter. If the show height of more than 2.5, you can see here more than 2.5 small square. If it is there, then it is suggestive of right atrial enlargement. Other thing is, if you are taking lead V1, since it is biphasic, as I said already, the first half is formed by the P wave, that is the right atrium. The second half of the P wave is because left atrium. So if there is a height of this P wave, the first half of the P wave, if it is more than 1.5 millimeters, that is more than 1.1 small squares, then it is called as right atrial enlargement. So what are the causes of right atrial enlargement? Is primarily due to pulmonary hypertension and chronic lung disease, tricuspid stenosis, congenital heart disease, and primary pulmonary hypertension. So, what are the mechanism which is responsible? As I've already said you, the mechanism which is causing this changes ECG abnormalities in the right atrial mass is because the greater RA mass. Since right atrial is more enlarged, more greater RA mass, and it generates more electrical forces and thus producing taller P waves. So because RA activation occurs early during the P wave duration is not prolonged. So if duration has to be prolonged, it is mainly dependent upon the left atrial enlargement. So you can see here, as you can see here, there is a tall P waves in lead 2. So you can say a right atrial enlargement on ECG based on the presence of P waves. So there are sometimes a condition like atrial fibrillation where these P waves are absent. So then how do you say in that patient whether atrial enlargement is present or not based on ECG? Is we'll be studying in this session called as ECG changes in right atrial enlargement in presence of atrial fibrillation. So normally, if there is right atrial enlargement, often many a times the patients are associated found to have right ventricular enlargement as well. So because the right ventricle, right atrial enlargement, because the common causes of right atrial enlargement. So that is mainly pulmonary hypertension is also responsible for right ventricular enlargement. And also what happens with the right atrial enlargement will be there, and it pushes the ventricles to downwards, so the changes will occur similarly. So if you find in ECG of atrial fibrillation, if there is RVH changes, there is right ventricular hypertrophy changes, which is found by like presence of QR type pattern in the right precordial leads without evidence of MI. So that is tall R wave. So if the R wave is taller in V1 when compared R wave in V1 is there. So normally R wave will be not that tall in V1 and V2 because these are right-sided leads. But in presence of right atrial and right ventricular enlargement, the R wave will be dominant here. So prominent R wave in the absence of any MI or low amplitude QRS complexes in lead V1. So since V1 is more on the right side, so you can see here there is tall R wave here in the lead V1. So suggestive of right ventricular hypertrophy. And also V1 is generally present on the lead is kept on the right side of the heart, right side of the chest. So on the chest it will be keep it in the right side of the sternum, whereas the V2 is in the left side of the sternum. And because of right atrial enlargement, what happens is right ventricle is shifted downwards towards the left side. So in V1 generally the QRS amplitude is found to be very much less when compared to lead V2. So you can see here lead V2, you can see here the QRS amplitude is this high. This is R wave and this is S wave. So QRS is very much higher in lead V2 as compared to V1, and the ratio of that, the V2 by V1 QRS voltage, if it is more than 6, It has a sensitivity of 50% and specificity of 90% to diagnose it as right atrial enlargement as well as right ventricular hypertrophy. Chest X-ray in right atrial enlargement. So what are the criteria for right atrial enlargement based on X-ray is if the vertical height of right atrium is more than 50% of right heart border, it is a more specific sign. So yeah, as you can see here, this is the right heart border. So if the right heart border is forming the right atrium, this is the right atrium and this is the right heart border completely, including the SVC and all. So since it is forming more than 50% of the right heart border, the right atrium, it is called as right atrial enlargement. Second, right atrial border extending more than 3 intercostal space. Here you can see here, this is the right atrial border. You can see here 1 intercostal space, 2 intercostal space, 3, 4, almost 4 intercostal space it is covering. So if it is, since it is more than 3 intercostal space, again it denotes that it is right atrial enlargement. Next, measurement from the mid vertical line to max convexity and right border of more than 5 centimeter in adults, more than 4 centimeter in children. So from the mid convex, this is the spine. From here, the distance, from this spine to this distance, if it is more than 5 centimeter in adult and more than 4 centimeter in children, if it is there, then also it can call it as right atrial enlargement. Next is right atrium. If it is extending 1/3 of the right hemithorax. So then again from the spine, you measure this distance. And from the spine measure this distance, the hemithorax distance. If the distance is more than 1/3 of the hemithorax, the right atrium distance is more than 1/3 of hemithorax, then also it is called as right atrial enlargement. So these are the 4 criteria to suggest that on X-ray, how can you say is the right atrial enlargement is present or not is based on these 4 criteria, but most specific is the vertical height of right atrium covering more than 50% of the right heart border. Hope you have liked this video. If you have any other queries, do comment in our comment box. Thank you.